Hi everyone, welcome if you're new to the channel. Here we discuss medical topics and lifestyle. In today's video, we will be talking about pelvic pain. In the video, we will be more specifically focused on around women's causes of pelvic pain. So we're not going to delve too much into the men's side of things, but nonetheless, pelvic pain affects many people worldwide, and it's important to identify the causes so we can get proper help for it if we're experiencing it. Pelvic pain can be acute or chronic, meaning it lasts more than 6 months. There's a lot of videos to make on this topic. You can get more specific, such as endometriosis and so on. But in this video, we will cover the causes of pelvic pain, what the doctor will do when you present with pelvic pain, and some common scenarios such as painful periods and pain when having intercourse. Let's get into the video. So first thing is first, let's get into what happens when you get to the doctors. So what happens when you come to the doctor's office with pelvic pain? Well, everyone's different. Everyone has their own story to tell, and it's important that you're allowed to tell your story and share your experiences with the pain and everything about it. Typically, your doctor will ask you about the pain, about the surrounding symptoms around the pain, and some of your past history. So when it comes to pain, we need to know where the pain is, how severe it is, when and how it started, so meaning the onset. Is there any pattern to the pain? Does anything make it better or worse? And if there are any other features, like vomiting, for example. Then we need to talk about surrounding symptoms if there are any, such as I mentioned nausea, I mentioned vomiting. Are there any urinary issues? And if there are any psychological symptoms. And finally, we would like to know about past history. So, did we have a surgery in the past? Have we ever had any infections or any other factors like that? Then, once all the information is gathered, a decision should be made whether to do an examination and whether to investigate as well. Right? So the examination will typically feature an abdominal examination, a pelvic examination, and a vaginal examination. Sometimes a rectal exam is done, but only if it's indicated. And also any other outstanding things that can be done, such as a cervical smear if one is overdue, for example. When it comes to investigations, generally there's a few things done. So a urine test can be done, along with a blood test and a pelvic ultrasound scan. If there's a strong sexual history that might be the cause, then there can be tests done to look for sexually transmitted infections as well. So that's what happens when we're talking about investigating pelvic pain. And now, in general, for the management of pelvic pain. So we mentioned at the start of the video what acute pelvic pain is and what chronic pelvic pain is. So we manage both. Here, we're slowly starting to get into more specific causes of pelvic pain as well. So when managing acute pelvic pain, if it's severe, if it's terrible, we admit to the hospital, right? Or if we suspect something that's pregnancy related, like an ectopic pregnancy. If it's not urgent, but it's just come on, then it's managed with pain control medication in the community. Generally, things like nonsteroidal anti-inflammatory drugs, as well as opioid-based medication. These are usually the go-to that your general practitioner or your family medicine doctor will provide for you. When managing chronic pelvic pain, we need to look a little bit deeper. So we need to try and discover the cause. Chronic pelvic pain affects about 1 in 6 women in the UK. There's often more than one cause for the pain, so the aim is to identify and address the contributing factors instead of assigning a single specific cause. So management of it thus involves what we mentioned a few moments ago, right? Doing the proper examinations, doing the proper investigations, and putting it all together to solve the puzzle of the chronic pelvic pain. So let's zoom in a little bit more into the causes of pelvic pain. So here we have dyspareunia. All right, so let's talk about some causes that affect people. Like I said, we'll make plenty of videos on these, but here's one specific cause. So dyspareunia is pain on intercourse. 10% of women admit to sexual intercourse that usually causes a bit of discomfort. It may be superficial or it may be deep. Superficial meaning it's felt around the introitus or the entrance areas, and deep meaning that it's felt deep inside. There's a psychological element in most cases, unfortunately, where there's a cycle of pain that leads to fear of intercourse, which then, of course, makes the symptoms worse, and the cycle goes on and on and on. And that's it doesn't help in the long run. So it's important to address both the physical and the psychological components here of what's going on. So when we're talking about the superficial side of things, we need to treat the cause if possible. In the meantime, we can try things to manage the symptoms, such as gels and things like that that can help help people have more comfortable intercourse. Causes of a superficial reason can be involving the vulva, the vagina, or the urethra. So when we're talking about the vulva, we mentioned vulvitis, which can be atrophic, infective, cancerous, things like lichen planus or sclerosis. Again, future videos on all this stuff. And then when we're talking about vaginal causes, we can see vaginismus. So when the vagina contracts, lack of lubrication, vaginitis for whatever reason, hymen issues, past surgical things that have happened there as well. And then when we talk about the urethral causes, urethritis comes to mind, as well as anatomical urethral issues that can be present. Then, when we switch it to the deep causes, to the other side, here we have causes such as endometriosis, pelvic inflammatory disease, a retroverted uterus, which can be seen on a scan, ovarian issues, ovarian masses, for example, and also non gynecological causes as well. Some of these are difficult to manage and investigate and may require you to see a specialist, for example. We need to examine and do the investigations, but if no cause is found or the cause is actually untreatable, then the pain ultimately can be decreased by limiting sexual penetration, sexual intercourse, but that's not a permanent solution. So we're always trying to find the solution to the problem. Now we get into dysmenorrhea. So what is dysmenorrhea? Dysmenorrhea means painful periods. Over 50% of premenopausal women have some pelvic discomfort around their periods, and 1 in 10 women find period pain significantly interferes with their lifestyle or their quality of life. It's usually felt as painful muscle cramps in the tummy down below, which can spread to the back or the thigh sometimes, and it can vary from intense spasms to more dull aches. We split up the causes of dysmenorrhea into primary and secondary. Let's talk about primary. So primary dysmenorrhea has no underlying pelvic pathology. So there's nothing actually there. It tends to start 6 to 12 months after your first ever period and when the ovulatory cycles are established. It presents with lower abdominal cramps along with sometimes some backache, and these symptoms usually occur in the first 1 to 2 days of each period. There may also be associated symptoms such as diarrhea and vomiting. Young women under the age of 20 in particular, with no other symptoms, don't really require a pelvic examination unless we suspect something really is going on there, right? Some sort of a pathology. If we're older than that, or if we suspect something actually is going on, then we have to do the full examination, like I mentioned earlier on in the video. So the pelvic, the abdominal, and the vaginal examination. Treatment of primary dysmenorrhea is simple for the most part. So we have NSAIDs, or non-steroidal anti-inflammatory drugs. They're about 80 to 90% effective, and usually it's recommended to start when the bleeding actually starts. So start them when the bleeding starts. Other treatment is the combined oral contraceptive pill, which also is effective in about 80 to 90% of people. 10 to 20% don't respond. So that was primary. Now we have to talk about secondary dysmenorrhea. So secondary dysmenorrhea suggests that there is an underlying pathology there. Secondary dysmenorrhea generally starts later than teenage years, where it may present at any time as a change in pattern, change in type, or change in the intensity of the usual period pain that we tend to experience. Pain can start just before the period and it can last throughout the period. It's often associated with deep dyspareunia, so deep discomfort when having sex or on intercourse, and other symptoms also are associated with it, such as abnormal bleeding or vaginal discharge. We have a list of causes for these kinds of things. So endometriosis is one, adenomyosis, fibroids, psychosexual problems, cervical stenosis, and polyps. So these are all things that we have to consider when we're thinking about secondary dysmenorrhea or painful periods. So as a whole, we have pelvic pain that can be split up into gynecological causes and non-gynecological causes. So those would be the main ways to separate what is causing pelvic pain. So we've gone over a few of the gynecological reasons, so some of the common gynecological reasons with the statistics behind it and what those things look like. But then once we split up our pelvic pain into gynecological and non-gynecological causes, we split them up then further into acute and chronic, and then manage them accordingly. So as you can see, there's a whole load of reasons that we can be experiencing pelvic pain, and it's important for us to investigate each and every one of them to rule things out. Some are more urgent than others, as you can see on the list, and some are not as urgent as others. So we've covered a few in this video, but more importantly, when we are having pelvic pains, and particularly when we're talking about period-related pelvic pain, so such as dysmenorrhea, then there are certain self-help measures that we can try. So what we can do at home is always something that we should obviously try doing. And then if we need to get others involved, or if things are getting a bit more serious, then we get our doctors involved. The main things here to try at home, or to try on your own, self-help measures to try, are to stop smoking. So smoking is thought to increase the risk of period pain. Exercise. You may not feel like exercise during a painful period, but being active may help reduce the pain. So you can try something gentle like swimming, walking, cycling. Heat. Putting a heat pad on, or a hot water bottle on your tummy may help reduce the pain. A warm bath, a warm shower. So those things can help relieve pain and help you relax. Massage, same principle applies there. Relaxation techniques, so yoga, these can all help us relax and distract us from the feelings of pain and discomfort. And then you can get even more bit specific and get like a TENS machine, so a transcutaneous electronic nerve stimulation machine, which can help as well. So that was a short video on pelvic pain. There's so many conditions to actually dive into, but this was an overview of it, what can happen, how you investigate it, and yeah, like and subscribe for more. Let us know in the comments below what videos you'd like us to cover in the future, and we will see you in the next video. Take care.